Hello, my name is Lorraine Bonkowski, and I'm a registered dietitian at Michigan Medicine's Hepatology Clinic. In this video, we will discuss why it is important for patients with cirrhosis to follow a low-sodium diet and how to follow this diet. Sodium is a naturally occurring mineral that plays a role in fluid balance in our bodies. A common symptom for patients with cirrhosis is fluid retention, such as ascites or edema. Following a low sodium diet can be helpful in reducing this fluid accumulation. To follow a low sodium diet, try to stay under 2,000 milligrams of sodium per day. Try your best to break up this number evenly throughout your day. For example, if you eat 3 meals and a few snacks, aim for around 600 milligrams of sodium per meal and about 100 milligrams per snack. Salt is the main source of sodium in our diets. Just 1 teaspoon of table salt has 2,300 milligrams of sodium. So try your best not to add any table salt to your food. Other high sodium foods include frozen dinners, condiments, cured meats, pickled items, and salty snacks. Also, restaurant and fast food can be very high in sodium, so try your best to limit eating out to about once a week or less. Here is a table showing some examples of high sodium foods. Condiments such as soy sauce, salad dressings, ketchup, and barbecue sauce can add up very quickly. It is important to not forget about beverages as well. Certain beverages such as sports drinks and tomato juice can be high in sodium. Milk also naturally contains about 100 milligrams of sodium per cup. Overall, cutting back on processed, packaged foods and doing more cooking from scratch will help reduce the amount of sodium in your diet. Reading nutrition facts labels will be the most helpful way to know how much sodium is in something. When you read a nutrition facts label, always look at the serving size first. For example, the serving size on this label here says 2/3 of a cup. When we look at sodium, which says 160 milligrams, then we know that in 2/3 of a cup of this food, there are 160 milligrams of sodium. Here are a few more tips with following a low sodium diet. Consider keeping a food journal to track your sodium intake every day. Doing this for at least a week can help give you a good idea of the amount of sodium in foods that you eat regularly. Use a pen and paper to write down your sodium content, or use websites or apps to help track your sodium intake for you. Try other flavoring techniques such as lemon juice, herbs, spices, vinegar such as balsamic vinegar instead of table salt. Also, avoid using salt substitutes such as no salt or new salt. These are very high in potassium and may not be helpful if taking certain diuretics or if struggling with kidney disease. If you would like more information about a low sodium diet, consider making an appointment with a registered dietitian. We hope that you enjoyed this video.